So, we are learning more and more about the impact of plastics on human and mammal biology. Plastics contain 15,000 chemical additives, and out of those, some 4,000 are estimated to impact human biology. We also have the life cycle issue, broken down into microplastics. They will circulate in our environment for a very long time and can take between 20 to 500 years to decompose. And we're going to dig into this topic now. Olwenn Martin first, Plastics and Our Future Health from University College of London. Welcome, Olwenn.
Thank you. And well done for making it to the last session. That obviously shows resilience. It's been a long day. So just give a brief overview of plastics. And if we take a minute to look around us, you can just wonder how many things are not actually made of plastics, from the carpets, your clothes, your glasses. You might have mobile phones and bank cards in your pockets. Plastics are very much part of our everyday modern environment. And indeed, we start our lives in plastic surroundings, from the plastic cribs in which we're first placed in hospitals, feeding bottles, disposable nappies, toys. We connect with plastic items from the start of our life, every day of our lives. Okay, so plastic comes from the Greek plastikos, which means to mold, and they're actually long chains. So polymers are actually long chains of these repeated units of smaller chemicals called monomers that are chemically bound with one another. We first encounter natural polymers, actually, according to the Greek geographer Pythias, in the Baltic, in Abalus, Isle of Abalus, which is probably modern-day Gotland, so in Sweden, in the form of amber being washed up upon the shores. So amber is a fossilized tree resin. It's a natural polymer that's been used since Neolithic times for jewelry, but also used in folk medicine for its purported healing properties. And there's something a little bit ironic about the fact that we were some of our first encounters is upon beaches, and we've talked about the ocean feelings, because plastics really become a visible issue when we first encountered them in the ocean, and the ocean plastic pollution came to the fore. And in the UK, it would have been David Attenborough sort of pulling a straw out of a turtle's nose. At the beginning of the Industrial Revolution, we first started modifying natural polymers, for example, by applying heat and pressure to make snuff boxes from horn. Later, we started chemically modifying natural polymers. You could argue that some of the first plastics were bioplastics. And it's not until 1907 that you have the first fully synthetic and commercially successful plastic, known as bakelite. So this is quite a relatively recent phenomenon. It's just a little bit over 100 years old. Since then, we've really expanded the family. So you have the one first dimension of the complexity is the number of different synthetic plastic materials. They will depend on the monomer, the repeated unit, and the way they are linked. So we have thermoset. They tend to be cross-linked, and you can't sort of remelt and reform them. They include polyurethane foams, epoxy resins. But by weight, the most common are the thermoplastics. So those derive from polyolefins, like polyethylene, polypropylene, polyvinyl chloride. You have the polyesters, including PET, polyethylene terephthalate, polystyrene, polycarbonate. There's already quite a big family of different materials, not just one. A word on sort of having framed this as a waste management issue, when it's looked at what was the visible part of that iceberg in a way, which ended up in the ocean. That's about 1%, 30 million tons. That's quite a lot, but that's about 1% of the accumulated plastics in the economy. So we can't dissociate the plastic issue from our addiction to oil and the fact that most of these compounds are actually derivative from fossil fuels. Over 99% of plastics are produced from chemicals sourced from fossil fuels. And in terms of the scale, we've got another one of these hockey stick graphs. If we look at the increase of production here, it only starts in 1980, and that's part of the OECD Global Plastic Outlook. And between 2019 to 2060, under business as usual scenario, we are tripling production. And part of that comes from emerging economies, but not just. So that's about the scale and kind of where we're going. This is where we're using plastic. What's important is like we've got nearly a third that's used by packaging, and packaging has got very short useful life. So a lot of this we produce and then we throw away after a very short time. Some of the other uses that we have are in construction, in textiles, electronics, and in vehicles. So I'll first talk about the life cycle impacts, some of the indirect impacts of plastics. So I've mentioned the link with fossil fuels, and there are also greenhouse gas emissions that are related to the production and life of plastics. At the moment, that represents about 3.4% of global emissions in 2019. But if we are on the business as usual scenario, that's expected to more than double. And here we've got some example of the other type of impacts that plastic will have. So on the horizontal scale, you'll have the factor by which they would be multiplied by 2060. And we can see that there's land use change, there's impacts on marine, freshwater, and terrestrial ecosystems, on the ozone layer, and all of these have impacts on human health in turn. The other important thing here as well is to look at the proportion of these impacts that are related to production rather than end of life. Because for most of these impacts, that's related to the production of plastic, not the way they are being disposed of. Some of these figures will vary slightly depending on the type of polymer we're looking at. So another aspect of plastic that really has captured imagination is these micro and nanoplastic particles. So there's two types of microplastic particles. So these are plastic particles that are less than 5 millimeter of diameter. You'll have the primary, those that are intentionally added or used in products, some of which have been restricted, at least in Europe. And you have the secondary one, which are the product of degradation of larger plastic items. And then it can degrade further, where you get to a size that's below 1 micrometer, and then you have the nanoplastics. One issue, because I think everybody wants to know what are the health impact of these micro and nanoplastic, partly because they've been found up everywhere we've looked, almost from some of the most remote environments to within our body. So one of the big challenge is knowing how to measure those. So their toxicity is going to depend on not just the quantity, but the size, maybe the shape of the microparticle, but also its composition. And we don't really have good methods for doing this at the moment. So you'll have microscopy, might give you some information about the shape and size, but not necessarily the composition. And spectroscopy is better at giving you the composition, but not necessarily the shape and size. So I know there's been quite a few medical analogy. In a way, we can't give you a diagnosis, a conclusive diagnosis, because we don't have the diagnostic tool for this. Nonetheless, there's been some efforts to sort of try to collect some of the evidence. One example here I've given is the TOMEX database. There's a more recent version, but it's behind some kind of paywall, not publicly accessible at the moment. But you can see that there's some studies that find effects, some studies that don't find effects. It's difficult to make sense of these because there's all these different characteristics that differ between these different studies. Some of the effects that have attracted some interest have been related to stress, which we see with other particles, such as oxidative stress, some inflammation as well. But yeah, we don't really know. There's some mounting evidence, but yeah, it's difficult. But there's another aspect of these plastics, is that there are additives that are added during the production of plastics, some of them intentionally, such as could be pigment, fillers, stabilizers, flame retardants, plasticizers. And then there are those that are left over from the production process, such as unreacted monomers. We have leftover catalysts. You might have biodegradation products. You may have contaminants they've picked up in the environment. Most of these are not necessarily chemically bound to the polymer matrix, so they can leach. And some colleagues have done this huge exercise, like trying to collate a database of these chemicals, and it found over 16,000 chemicals that are potentially associated with plastics. So that's another dimension of the complexity of the issue we're looking at. And about 6% may be regulated, and that's going to be very, very different from your pharmaceutical in terms of the level of information that's needed. It's going to be very, very partial if there's any type of regulation. But we don't necessarily know about the hazardous properties of most of those. And they're called additives, but that's a bit of a misnomer to some extent, because yet some of them are present by weight in less than 1% of the material, but they can make the majority or a large proportion of these materials. The example is some plasticizers like phthalates in PVC that can represent up to 70% of the material by weight. So it's not, it's not what you envisage when you think of an additive. And we know we're exposed to those as well. So that's an example that we're just really looking at the subset, because I was looking at those that are in food packaging, and we know we'll be exposed to those. And looking at those that had been looked at in human samples, I think there's 182 that were looked at, and 140 of those were detected. And this list was expanded by looking at some of the metabolome and exposome database, and we could find another 1,300 chemicals. So we're dealing with about, just from this subset, those are associated with food contact material, where they should be a little bit more tightly regulated. We're already dealing with about 1,500 chemicals for which we know that people could be exposed to them. We know a little bit more. There's a bit more robust evidence, and I think we'll hear more about this in terms of the type of effects. There have been some groups of chemicals that have been quite highly studied, and we've got yet another hockey stick graph here in terms of the amount of literature that's been used to look at some of these persistent compounds, the polychlorinated biphenyls, the forever chemicals, the PFAS, the flame retardant, the PBDEs, but also some of the plasticizers. So we have accumulated a fair bit of evidence on some of those. And yes, where we have the most of the data and interest has been looking at endocrine disruption, including the metabolic disorders. And I don't know if there's any endocrinologist in the Planetary Health movement or in the room. Most of the research has been done in North America, Europe, and China, and we have a protocol to sort of expand some of that work to other groups of chemicals. Turning to looking at some of the solution and advocate for taking a system view of the solution. So I've got a complex graph here, sort of looking at the stakeholders, mapping the stakeholders and their relationships. Here just for the humble plastic bottle, drink bottle in the UK. And there's a number of things that we notice in terms of the imbalances. So there's definitely a strong drive to incentivize production and consumption, which have sort of really inspired some of the way the problem has been constructed as a waste management problem and not really wanting to touch as that side of things. They have incredible lobbying power, some of these vested interests, sort of these upstream stakeholders. Sometimes it's difficult to change the system because there are some locked-ins, whether they're technological, regulatory, or in terms of infrastructure. And we've got the downstream users, those that are dealing with waste management, actually operating at a more local geographical scale. Some of the potentially faults, if you only look at one dimension, you could be led in a wrong path in terms of looking at solutions. One of them is the circular economy, because of difficulties with some of the recycling technologies, but also sorting some of the waste. You can actually concentrate some of the contaminants in some of these plastics, and now they are minimum recycled contents. So you end up with a toxic loop rather than circular economy. Another solution that's been looked at is to transition from fossil-based to bio-based plastics. So it's important to note that bio-based plastics are not necessarily biodegradable. And then that's quite a complicated draft that we're sort of looking at some of the different, comparing the conventional fossil-based towards bio-based. And you have to be careful, we're not just looking, again, at just one dimension, but looking at different dimensions of sustainability, because you can shift problem from one dimension to another. The most obvious one is going to be land use change and the impact on food security, like we're seeing with biofuels, but you have other ones that may be related to land ownership, labor rights, human rights. In the EU, we have a chemical strategy under the Zero Pollution Framework. We have a chemical strategy for sustainability that is sort of trying to take this system view and developing safe and sustainable by design criteria. At the moment, it's not entirely clear to me how that's going to be integrated and implemented in policy. And there are still a number of areas where it needs to be, we have some gaps. One of those is a lot of the life cycle assessment methods are comparative. So they will compare one plastic bottle with another plastic bottle. They're not necessarily looking at the effect on planetary boundaries and absolute sustainability. So that's one area of work. And the other one is also looking at social sustainability. So to conclude, we are being exposed to plastic chemicals and micro and nanoplastics. The evidence of health effects for micro and nanoplastic is mounting. We have convincing evidence for some classes of plastic chemicals that they are impacting our health. At the same time, there are thousands of chemicals for which, in plastic, for which we know very, very little. It's quite clear that if we let plastic production and consumption increase, we also increase the direct and indirect health effects of plastics. And a systems approach will allow us to identify some of the trade-offs and possible unintended consequences of solutions. But also something that's forgotten sometimes is can also allow us to identify some of the win-wins. So there is a relationship between ultra-processed foods that need to be packaged and plastics. And when I'm being asked, if you're being asked by patients, I'm not a medic, but I get asked, but journalists or others like, what would you tell people to do? I said, try to cook from scratch because you're sort of getting better nutrition at the same time as reducing some of your exposures. And I know there can be socioeconomic barriers to doing that. So another solution there as well is to look at community kitchens and also dealing with some of the connection that food can offer.
Thank you.
That was it.
Thank you.
Thank you.
Very complex and scary picture emerging. As plastics, we starting to believe affect humans, of course, the most vulnerable systems are most exposed, such as human fertility. And our next speaker, Pauliina Damdimopoulou, is doing groundbreaking research into how human ovaries are reacting to chemical exposure at the deepest levels of metabolism and energy production. Welcome.
Thank you so much. I almost feel like saying good evening. It's been a long day and it sure feels like sleepy time for me as well. But let's now dive into one more topic that hasn't been really looked in detail yet, which is the human-made chemicals that end up as pollution in the environment. So I'm Pauliina Damdimopoulou, and I have been working for the past 10 years at Karolinska Institute, leading my research group Chemicals and Female Fertility Lab. And I want to start by acknowledging all the wonderful members of the lab and the funding we've had and still have, thankfully, and the collaborators that have made it possible for me to look into human ovaries, environmental pollution, and female fertility. So when it comes to the human-made chemical pollution in the environment, they are also known as novel entities, so they relate to this planetary boundary. And this was quantified a couple of years ago, and it was concluded that this boundary has been broken simply because we are producing and releasing more chemicals to the environment than we can assess and monitor. So let's discuss these two topics a little bit. So the annual production of chemical has skyrocketed since the Second World War. That's when the industry promised us better things for better living through chemistry, and this surely did happen. So you can see here a figure illustrating the global chemical industry sales, which is one of the most profitable businesses around, and also the global productions of plastics. And what you need to keep in mind is that we are in that part of the curve. What we have today is a snapshot in time of a development that is escalating. So our children will have a different situation. As was pointed out, these novel entities have become so integral parts of our lives that it's very difficult to imagine how to live without them, especially if I discuss with my children. So electronics, cosmetics, the way we produce food, pharmaceuticals, and obviously plastics are a great source of human-made chemicals. And the problem is that they end up eventually in the environment. And depending on what decade you're on, you have your different scandals. Now we discuss a lot the PFAS chemicals that we now have in the global rainwater, in sea foam, in drinking water, and for example, in organic eggs. So these become very difficult to avoid in our bodies and on our plates. And of course, then we need to consider if these could be connected to any kind of health issues, which is the topic of the talk. And here we have a lot of lessons we can learn from the past. For example, up here in north, we have the Baltic Sea that has been the most polluted sea in the world. And for example, in the 70s, we nearly lost the Baltic seals and the eagles due to organochlorine pollution. For example, the famous pesticide DDT. And we found that these chemicals were linked to, for example, uterine lesions in the seals, poor immune health, poor offspring survival, and the eagles had very thin eggshells and also poor offspring survival. And when the environment was clean, these populations have been recovering. Also, invertebrates are affected. The French got very upset when their oyster farms collapsed due to triple-2 tin contamination in harbor areas. This is a strong aromatase inhibitor. It reduces estradiol. It will interfere with the reproductive tract development in these creatures, and they grow a pseudopenis on the top of their oviducts that makes them sterile. Alligators is another famous example from the US, from Florida lakes. Again, the organochloring pesticides leading to reproductive tract malformations, micropenises in the males, disrupted ovaries in the females, and poor offspring survival. And of course, also the pharmaceutical waste, including the contraceptive pill, synthetic estrogens that go through the wastewater treatment plants and can affect feminization of male fish, for example, leading to population collapses over a couple of populations. So a lot of evidence from the wild that pollution, man-made chemicals in the environment is not necessarily great. And when it comes to humans, of course, this has been a big topic of research. And since the 90s, we're discussing the declining sperm counts in men. Raise your hand if you heard of the spermageddon. Couple of people. So the diminishing man, it's predicted that the sperm counts will be about 0 in a couple of decades. We'll see if that will happen. The median, I mean. But it surely has received a lot of media attention. And now, particularly when we are getting this alarming report of declining birth rates all over the world, we are starting to ask if this pollution might play a role. So in order for a population to remain constant, every woman should have 2.1 children. And actually, over half of the countries in the world are now below this rate. By the end of the century, the global birth rates will be below 2.1. Europe, US have been below this rate for the past half a century. And this becomes a very exciting political discussion because we can only maintain the population through immigration. Otherwise, we have heavily aging population and too little children. Fine, so obviously people decide if they want to have children. So this is a difficult statistic to interpret. And how would I say, fortunately, we have good statistics on infertility treatments. So this is something we can look at across the globe as well. Since the first IVF baby in 1978, there's been about 10 million babies reportedly born through assisted reproductive technologies. Until now, Europe has been the leading continent with about 1 million treatment cycles a year. This is now shifting to Asia. And thanks to these treatment cycles in Europe, up here north, up to 10% of children are born through IVF. So every classroom has a child that wouldn't be there without these treatments.
Wow.
And this is also something the governments are now offering as a solution to the birth crisis. Let's make IVF more accessible. There's countries that provide now these treatments to women who are over 50 years of age, who are menopausal. So in that situation, it's of course very difficult, but even in the younger women, it's good to understand in the younger couples, not everyone will get help. About 1/3 of the couples going through IVF treatments will remain childless. So this is not the solution. So in summary, we are producing, releasing chemicals in the environment. There's wildlife evidence that they might interact with the reproductive systems, and we are seeing that humans are getting more and more problems with their fertility. So not great. So how do we do the assess and monitor the safety of these chemicals? This is an iceberg from the Chemical Strategy for Sustainability by the European Commission that was published 5 years ago. And it shows the current situation. We estimate that we have approximately 100,000 chemicals on the market in Europe. We are not good at keeping track of our chemicals. So globally, it's maybe 350,000, some people say. Could be more, could be less. The great thing that EU has the world's best chemical legislation because we have a chemical legislation. We also have a strong ambition to have a safe and sustainable economy by 2050, and that includes chemicals that are not posing human and environmental health risk. And yet the starting point is this: 70% of our chemicals are poorly characterized. Only the peak of the iceberg, those 500 chemicals, have been thoroughly characterized, says the Commission. And when we follow all the guidelines and do the thorough characterization, the question remains if we're actually testing for the right things. Are we doing the correct things to predict health risks? And one such endpoint that is discussed a lot is the endocrine disruption by chemical pollution. So chemicals entering our bodies for some reason have the capacity of interfering with our hormones, and that can lead to different types of health consequences for us and also for our children. So if the traditional toxicity is the study of increasing a dose of a very toxic chemical and seeing when the animals die, get mutations or tumors, being quite easy setups and clear endpoints to measure, then endocrine disruption is something quite different. Here, actually, the effects vary based on the developmental time point. Fetuses and children tend to be more sensitive because their organ systems are developing. Therefore, we have these low exposure effects. I agree that if we have, let's say, 100 times higher levels of these classical EDCs, they become traditionally toxic, but they do different things at these very low levels. They're all exposed to mixtures, so we also have combinatorial effects that are really difficult to predict. And then the endpoints and outcomes are complex to measure, and there might be decades between the exposure in utero and the manifestation of the problem. That could be fertility or infertility later in life. So when it comes to EDCs, we discuss a lot neurodevelopment. These exposures have been connected to reduced IQ points and attention disorders in children. We also discuss metabolism. Higher exposure leads to susceptibility to gain weight easier than that would lead to diabetes, for example. Reproduction we mentioned, much better studied in males. We have the testicular dysgenesis syndrome, well established and even used in the chemical health risk assessment as an endpoint to predict toxicity. And then immune toxicity that has been used recently more and more as a measure of endocrine disruption. And now the disclaimer, I study female fertility, so we are not going to discuss those other topics much. I'm focusing a lot on the research I do. And some of the famous EDCs that you must have heard of are listed on this screen. And I picked these ones because we often think that they always look like hormones with those phenolic rings. This is not the case. Take a look at almost anything, small molecules. So the next thing that I wonder if we're looking decently enough when we assess the toxicity of chemicals is, of course, reproductive health. And when it comes to regulatory toxicity testing, this is the state of the art, the rat. A few fun facts about rats. They are extremely fertile. A rat can make up to 20 oocytes every couple of days and it never goes through menopause. A woman makes 1 egg a month for a limited amount of time and spends most of her life in sterility after menopause, or not most, but a lot of the lives. So when we test the reproductive toxicity of chemicals, we take these young fertile rats, we expose them for a couple of weeks to different doses of the chemical, and then we check if she has her estrous cycles. We mate her with the male rat and we check if she gets pregnant, how many pups she has, and then the pups are followed if they go into puberty normally. And then you take the weights of the reproductive organs. For males, we also check the sperm counts because we know this is a very sensitive endpoint. So these are also very expensive assays to carry out, and therefore we don't do them to all chemicals. Only high production volume chemicals are tested at all. Only if the chemical goes on market at least 10 tons a year by a single manufacturer, you need to do a rat assay. Chemicals less than that, not tested at all. And if the chemical passes this test, we consider that it has no problems. It won't pose a risk for reproductive health. So let's now see what women commonly have. Women of reproductive age have many issues. So most common ones are ovulatory disorders like polycystic ovary syndrome, affecting up to 25% of women, endometriosis, 10%, uterine fibroids, up to 40%, and all these contribute to infertility. And in all these, we have epidemiological evidence that higher chemical exposures will increase the risk. So now if you look at the assay we do to predict hazards for female reproductive health and the typical health issues, I hope you can see the same gap as I do. So I don't think we're really measuring good things to predict effects on female reproductive health and fertility. So I've been doing my research in Sweden, and I will show some of the results I have from the studies I've done here. I started by looking at the exposure of women, their eggs and babies to different chemicals. We have no methods to measure those 100,000 chemicals reliably, so you pick what you want to measure when you start your exposure assessment studies. And I decided to focus on very usual suspects. We have these persistent organic pollutants that led to the collapse of those seal and eagle populations. They've been internationally restricted. We have the forever chemicals, the PFAS. It's thousands of chemicals that are in the rainwater and the sea foam. Some of them are now internationally regulated, most of them are not. And then we have these fun additives and plastics like bisphenols, parabens, and phthalates. They are metabolized quickly, to my knowledge, we don't have any international regulations. And some of those have been so amazing chemicals they even got the Nobel Prize. So human eggs are in the ovaries in immature state. They grow to maturity before being released, and they grow in this liquid bag called a follicle. And we measured levels of these chemicals inside the follicle. And you can see on the top two things on this picture. The full circle means all the women had the chemical in their ovaries, and the color tells you how much of it. So on the top row, we have these persistent chemicals that were banned in Sweden 50 years ago. We find them in all the women because these are very long-lived chemicals and they remain also in the food supply. PFAS chemicals, not well regulated, we find them even more commonly and in higher concentrations. Bottom row are the quickly metabolized chemicals, and maybe to my surprise, we were able to find many phthalate and paraben metabolites in every ovary sample we studied, although these are quickly metabolized. So human eggs grow in a soup of toxic chemicals and maybe many more that we didn't measure here. These eggs get fertilized, they become babies, and before that they grow as fetuses in the womb, and the chemicals follow. The persistent chemicals pass the placenta, they deposit to human fetal tissues. Here's trimester 3 human fetuses from the Stockholm region. So the exposures are truly lifelong. They start when we are germ cells and we keep being exposed when we're fetuses and obviously in postnatal life. Does it matter is the biggest question, of course. Having a chemical doesn't mean it's a problem. And this is what we have been looking at. So what we found in my studies is that fertility is hit at multiple points by exposures. Women with more chemicals have fewer immature eggs left in their ovaries, suggesting accelerated reproductive aging. The way the follicles grow to maturity is altered, the quality of the embryos is reduced, and this leads to longer time to get pregnant and higher odds of being classified as infertile. And this is nothing shocking. This is what other people have found as well. I just verified that this happens even in Sweden. These are associations, and we need causation. So now my lab is working on many experimental models to prove that it is the chemical causing that effect. And I will give you one example related to this forever chemical PFOS, which is the most abundant of the persistent chemicals we measured in ovaries, about 9 nanomolar in the women in our study. So this is one of the thousands of forever chemicals. It's been used for almost 100 years. And we saw that it was predicting lower embryo quality in the women in our studies. So what we did was that we used cow eggs as a proxy. We went to the slaughterhouse, we got cow ovaries, we extracted 2,000 eggs, and we exposed them to PFOS at the level that is even less than in the ovaries of women, 4 nanomolar, and a level that is tenfold higher than the average. We exposed only for 24 hours, and then we fertilized the eggs and followed embryo development for a week in clean conditions. Yes. And what we found was that PFOS compromised the embryo development. Higher level visually reduced the quality of the embryos that didn't cleave and develop normally, also affecting gene expression and epigenetics. The lower level didn't have any visual morphological effects, but it also altered gene expression and DNA methylation. And these are the mechanisms we predict are speculating that chemicals are mediating their effects transgenerationally. So I think it's also a little sad that we found the low-level effects. And none of this is anything new. So in the famous book, Silent Spring, the author said already in 1960s that this is the first time we're all exposed through the life to toxic chemicals. And she was describing all these classic toxic effects of acute death and central nervous system toxicity and so forth. And she even was speculating what would happen if these exposures go on. We have the cumulative exposures across generations, and she predicted that children are more sensitive. This was 60 years ago. The second important book came in the 90s, establishing endocrine disruption. And she said, the author, that we've been now exposed to these chemicals so long that we can no longer define normal, unaltered human physiology. And she shifted the focus from acute toxicity to more these behavioral, hormonal, endocrine effects of the chemicals. And she was calling for better EDC regulation, which is what we're doing here today. This was 30 years ago. To take home and think about, the planetary boundary of novel entities is broken. We keep producing and adding chemicals in the environment. We are stuck with old-fashioned tests to assess the effects of these chemicals. Instead of using the state-of-the-art academic literature, we use the RAM. And we see human health deteriorating exactly like those books predicted a long time ago. Fertility rates are plummeting, we have IQ points lost, and we have obesity epidemic reaching younger and younger populations. But obviously, since the rats don't predict these effects, we can keep producing chemicals and speculate that human health is affected by something else. I'm quite convinced human-made chemicals in the environment are a real issue, and I want you to solve here for me today how we can finally break this downward spiral that has been going on since the 60s. So thank you so much.
Thank you.
Pauliina, for this passionate advocacy, and you have asked for a solution, and I think we are looking to you, Leonardo Trasande, from NYU Grossman School of Medicine, on a global plastics treaty. What could that look like? Who wants it and who doesn't want it?
Thank you so much. So I have the unenviable task of separating you from dinner. And at the same time, I hope to keep you engaged with the color. I followed through on the requested promise in terms of what I brought here today. I am not going to just talk about the Global Plastics Treaty because a rare moment of hope exists in the United States when it comes to endocrine disrupting chemicals, and particularly chemicals used in plastic materials. But first, I'm going to hammer home a point. Others have already really, in a wonderful way, brought home the role of plastics in driving endocrine disrupting chemical exposures, contributing to novel entities. But plastics in general are breaking all the planetary boundaries. They are a key part of the maelstrom that we are facing today. They are a planetary health issue, as side by side with heat, diet, air pollution, and climate change. So please allow me to just make this point emphatically that plastics are part of the planetary health mindset. And plastics are a two-domain issue. There are the microplastics and the nanoplastics. There are the dissolved organic chemicals, the additives, the monomers, and what have you. And I would argue that we didn't really get public awareness on plastics and human health until we started to see the microplastics and nanoplastics in people. That's what really sparked the imagination. It was akin to the plastic straw being stuck in the sea turtle. And these are the data that show that point when it comes to micro and nanoplastics. You look for it, the technology tells you it's there. And as a pediatrician, I will tell you that kids literally excrete more microplastics and nanoplastics than adults as well. So particularly vulnerable populations are even more exposed. But we know very little about the effects of microplastics and nanoplastics specifically on human health. This New England Journal of Medicine article really drove that point home and drawing the point home in terms of the alarm. In the carotid arteries, polyvinyl and polyethylene microplastic were found and related to a fourfold increase in the composite outcome of heart attack, stroke, and death. And yet, at the same time, we have very little precision about measuring microplastics and nanoplastics and reading across studies. We have few standards to compare. Reference materials are rare, only really polystyrene, which is not really as much a major driver of human exposure right now. We also have the fact that not every particle is alike. We're talking about size, we're talking about chemical composition. I can't even tell you whether it's a particle-like effect that's driving the cardiovascular risk described here, or if it's the toxic drug delivery systems akin to the drug delivery system I used to get acid suppression to my esophagus and stomach this morning. So we have a situation where we know so much less about microplastics and nanoplastics in human health, but we know much more about the chemicals used in plastic materials. And that's why I need to emphasize today that we need to be as curious about the invisible as the visible. Yes, I apologize. I did not have a Swedish Ted Lasso analogy to work with, but I hope you understand where I'm coming from. And others have reiterated this analogy in other contexts, but I hope you carry home today the fact that when you think of planetary health, it's not just the visible heat, it's not the visible aspects of diet. It is the chemical exposures that are also playing a crucial role in driving the same morbidity and mortality that you all have emphasized throughout this intense day and a half that we've already had thus far. And others have already, Pauliina and Olwenn, have really done a tremendous job of driving this home. I'm going to focus and hammer home a little bit on a few categories of chemicals used in plastic materials. We're talking about bisphenols used in polycarbonate and aluminum can linings. We're talking about phthalates in food packaging. We're talking about the nonstick chemicals that are rising in use in fluoropolymer plastics as we've come to address polycarbonate, polyethylene, and polyvinyl chloride as plastics of concern. We add flame retardants to many of these plastic materials, adding to effects on human health, brominated and organophosphate, replacing the brominated variety. We have a problem with regrettable substitution that is consistent with the other presentations thus far. And if I can raise one point already to poke a hole in a solution, we will not burn our way out of this problem. You burn plastics, you create dioxins. Dioxins are an extremely carcinogenic category of chemicals. So if we are going to solve this, we are going to have to find another way. I'm going to quickly buzzsaw through in a little bit of a deeper dive into specific human health studies. We know that thyroid hormone is crucial for baby's brain development. The baby relies on mom's thyroid hormone through the second trimester of pregnancy. And we know that even in the subclinical range, this is something that an obstetrician is not empowered to detect. Changes in thyroid hormone during pregnancy produce cognitive deficits, autism, and attention deficit hyperactivity disorder. We now know across 4 longitudinal cohorts that brominated flame retardants are consistently associated with decreases in IQ, independent of lead and other social determinants of health. We know that phthalates literally shrink baby's brain size. Total gray matter is lower in relationship to prenatal exposure, mediating the relationship that's described with IQ at age 14. This is from a Dutch cohort, not far from here. We know that these chemicals, phthalates, decrease thyroid hormone function. That's another connect the dots in the chain of causation. I'm never going to tell you that an association study by itself proves causality, but if you look at the Bradford Hill criteria, many of these are met, particularly for neurodevelopment, by chemicals used in plastic materials. We know that babies are born too soon due to phthalate exposures. Here in our own U.S. large birth cohort program called the Environmental Influences on Child Health Outcomes program, we identify not only associations of phthalates with food used more frequently in food packaging like di-2-ethylhexyl phthalate, we find replacements of DEHP, DIDP, and DIMP, not just associated with the same outcome, but associated with worse outcomes. These are regrettable substitutes par excellence, unfortunately. And already, we've described 5 to 10% of prematurity in the U.S. associated with these exposures. That's direct medical costs in the order of $4 billion a year. Those are externalities. These are overproduced chemicals compared to the socially appropriate amount and produced at a lower cost than the true social cost of exposure. Moving on from cradle more to grave, we know that phthalates literally contribute to oxidative stress and inflammation. They're metabolic disruptors, and they directly have been associated with cardiovascular mortality. This is a very recent study we did extrapolating to global mortality. I acknowledge there are very few studies of phthalate exposure in low and middle income countries, but if you take what we know at the present time, we're talking about 356,000 deaths a year. Many people in the environmental health field focus on lead. We've already seen about air pollution. It's important that we put plastics on that same level and radar. We're talking about 10,000 million years life lost in relationship to exposure. And the disproportionate burden is not where you would think it is. It's not in the high-income countries. We're talking about the low and middle-income countries that are taking on a disproportionate burden, 73%. And when you look, and this is disquieting, the social costs of this mortality are $510 billion to $3.74 trillion. If you add up either the year's life lost and use a value for that, or take the value of a statistical life into account. The global plastics industry revenue is only $750 billion a year. So we already may be losing more as a society from the revenue of a major industry that's driving chemical exposure. That's not a very comfortable reality. We know that obesity and diabetes are driven by these exposures. I'm not minimizing the role of diet and physical activity. I'm not messing with the Lancet Eat Commission, trust me. But the fact is that chemical exposures used in plastic materials are a third leg to that stool. And I will not be able to go through all the studies presented here, but this is a large body of evidence with replication, consistency, and mechanism. PFAS, for example, slow resting metabolic rate, and are associated with weight regain in people who have dieted and lost weight through healthy diet as well as physical activity. I am not going to be able to follow Pauliina's act and really do justice to the gravity of the consequences, but I'm going to just take a moment to emphasize that the male fertility, as Shana Swan has described in her book, is disrupted not just as a result of adult exposure, but likely as a result of prenatal exposure. Phthalates disrupt reproductive development in an anatomical distance that you are born with, and that is the distance you get except for a brief period called mini puberty for 2 weeks at around 3 months of age. And phthalate exposures shrink anogenital distance in males, setting an adult male up for a profile of reduced fertility as a result and reduced sperm count. And that is something that cannot be reshaped in any other way. Now, you'll say, Leo, this is new science. This isn't in medical school curriculum. Where is the acceptance? This is mainstream science at this present time. The first report that really drove this home was the Endocrine Society scientific statement in 2009. At that time, it was really a laboratory phenomenon. I had already finished my environmental health training, but mind you, I was just entering the field at the time. That tells you how much of a paradigm shift we're facing when we're thinking about chemicals used in plastic materials. The 2012 WHO UNEP report further drove this point home, documenting a global public health threat posed by endocrine disrupting chemicals. This was rapidly followed by a second scientific statement by the Endocrine Society in 2015, documenting human evidence, 1,331 scientific references, mind you. That's in a second scientific report 6 years after the first. I know many of you in the audience have written these kinds of reports. It takes a lot of evidence to make people write a new document 6 years after the first and update it. You can see on the lower left, clinical guidelines by the International Federation of Gynecologists and Obstetricians, my own American Academy of Pediatrics putting evidence particularly to bear on chemicals used in food packaging, the World Obesity Federation on the upper right. What I think is going to move the needle most substantially and move this into the clinical arena is the National Academy of Sciences report that recommends clinical testing for people who live in areas where there is a water supply contaminated by PFAS. It recommends medical monitoring in relationship to the exposure. You have major diagnostic labs in the United States putting this into practice and actually driving clinical care. The costs are substantial. In Europe, the cost of endocrine disrupting chemicals, these are all uses, 163 billion euro. You can see all the reasons why that's an underestimate below. In the US, the costs are even higher because of the flame retardants we talked about earlier. These are exposures we intentionally put into furniture thinking we were going to save the spread of fires, but it saved no lives. It simply contaminated an entire population in North America out of proportion to elsewhere in the world. If there's a point I can push here today, policies predict exposure, exposure contributes to disease, and disease ultimately affects us all. Now, a lot of these endocrine disrupting chemicals come from their use in plastic. It's not just food packaging. It's the lining of nonstick cooking materials. It's paint. It's nail polish. It's more ubiquitous than meets the eye. And when you look just at the US costs across a broader array, not just cardiovascular risks, we're talking about $250 billion a year just in the US alone. So likely that $510 billion to $3.74 trillion cost of cardiovascular mortality due to phthalates could be even higher if you took the totality of diseases that we're talking about with strong scientific evidence for action. And the impacts are particularly profound in populations that experience the life cycle of plastics, particularly at the end phase. Now, there are safe and simple steps in the clinical arena to reduce exposure. We need to renegotiate our relationship with plastic fundamentally. We know that good news is you can reduce these exposures in days in high-income populations as depicted here, as well as in low-income populations. So this is not a well-to-do kind of intervention model or mindset. The household environment is important too. In a facility not unlike this at Harvard, I don't know why they do these things, but they did a trial of different levels of healthy buildings interventions, and the levels of chemical exposures to PFAS, flame retardants, and the replacement flame retardants, the organophosphorus esters, were stepwise lower in relationship to the intensivity of the healthy buildings intervention. I suggest in my patient population at Bellevue Hospital, where I work with in pediatrics, reducing canned food consumption, avoiding nonstick cooking, going to cast iron and stainless steel, particularly not microwaving or machine dishwashing plastic among the safe and simple steps at play. But we also need policy. And this is where it gets a little odd. I worked for Senator Clinton. That's how I got into the field of environmental health, through a legislative fellowship after my pediatrics residency. So you're going to ask me, why do I have Secretary Kennedy up there? Well, I'm not talking about vaccination policy. I'm talking about plastic pollution. His statement at a roundtable that I joined 3 weeks ago was amazingly aligned with the American Academy of Pediatrics 2018 statement on food additives. This is an area where we've met people where they are, and we can move the needle in a policy and prevention mindset. We have a phenomenal opportunity. And that policy window is really important when it comes to ultra-processed food and chemicals that are assumed to be generally recognized as safe in the United States. This is something, for whatever reason, the Make America Healthy Again movement really has in its teeth. And it's an opportunity where we can see momentum in places where mostly we feel like we're in the dark. Now, globally, and I'm going to start to close, we have the opportunity to expand beyond that in the form of the UN Global Plastics Treaty process. This is a very ambitious process from go. I followed it from beginning to end. I was at the pre-meeting in Dakar, and I'm going to follow it all the way to Geneva in August, and I bet it will go beyond, because these are hard things to accomplish, and we can do hard things fundamentally. As we think about this process, I want to really expose the recycling myth. 9% of plastic's lifetime have been recycled. The best companies can recycle 30 to 40%, and what little we know about recycled plastic is it actually carries chemical contamination from the previous cycle of use. It has metals, it has phthalates, it has bisphenols. If we are thinking about a solution, I'm poking another hole, unfortunately. We cannot recycle our way out of this mess. We need to maximally reuse and reduce plastic production ultimately, while getting chemicals of concern out of plastic. We need to simplify if we are going to keep some plastic, we need to simplify and think about essentiality as a principle that's driving it. We have very little information about chemicals and their effects on human health, yet we already know there's so much of a problem. Policies are extremely thin in this space. Fewer than 200 of the 16,000 chemicals used in plastics today are regulated. We have much to do. We can put phthalates, bisphenols, PFAS, and flame retardants on lists for derogation globally. That would be a tremendous advance and will face substantial resistance from vested interests. So we need to also explore biomonitoring globally. If we're going to track our ability to achieve benefits in populations where plastic production is exponentially growing, like low and middle income countries, we are going to need more biomonitoring data, particularly in the global south and low and middle income countries where exposures are likely to increase, not decrease. And finally, we need better research in this space. We have many gaps. Thousands of chemicals without safety data. We need the equivalent of an IARC for chemicals used in plastic materials. I'd add pesticides just to make it comprehensive and simple that way. So I'll just close by saying we need to reduce plastic production. We need to understand, I'll be able to talk about bioplastics in Q&A, but we have to particularly keep a mindset that uses hazard rather than risk. With the suite of chemicals in play, we are probably not going to be able to rely on exposure-related risk to assess safety, particularly for long latency conditions. And we need science, independent science, mind you, to drive the process. So with that, I just want to allude that we'll be having a symposium in September around the UN General Assembly meetings to talk more about plastic and human health with a particular focus on solutions. Thank you so much.